This is Mr. Harms, and today we're going to finish talking about the endocrine system. So there's a variety of different hormones as we've started talking about, and we're going to pick up where we left off. So the first one that we're going to specifically talk about is something by the name of androgens. So androgens are going to be those low-level male sex hormones, and there's specifically two of them. So the first one is testosterone, which we're familiar with, and there's also one known as DHEA, which stands for dehydroepiandrosterone. So what these do is, one, in males, they play an early role in the development of male sex organs. So this is going to happen during childhood and then in through puberty. Females also have a very, very, very small amount of testosterone. And what it does is it allows for there to be hair growth, body hair growth specifically during puberty. Now with females, we have what are called estrogens. And so these are going to be low levels that are going to be produced by the adrenal cortex, which we talked about in the previous slides. Now, the vast majority of these organs, or the vast majority of these hormones, are going to be produced in the testes and the ovaries. That is where they're going to be produced. So some of the hormones of the medulla, we have what are called catecholamines. So what catecholamines specifically are designed for is to release both epinephrine and norepinephrine. What these do are they allow for us to have the fight or flight response, which we talked a little bit about that during the sympathetic and parasympathetic nervous systems. They are going to increase the amount of blood flow to the brain and the muscles. And they're also going to increase heart rate, breathing rate, and blood pressure when we are in that fight or flight response. We also need to talk about something called pancreatic islets. So your pancreas, we've talked about briefly, but what the pancreas does is it's going to basically secrete two different hormones, and those are insulin and glucagon. Basically what these are, and you can see them right through here, this is basically just a lot of endocrine tissue that builds up and is scattered throughout the pancreas. That's what these pancreatic islets are. So you can kind of see them right through here. You've also got some exocrine cells, and then you have a pancreatic duct that is going to allow for insulin and glucagon to go to its final destination. So we talk about insulin. When you need insulin is when you have high blood glucose levels. Generally, insulin is going to cause the body to take in more glucose. So what happens is this. So you have your glucose right here. What your glucose is going to do is it's going to pass through a protein on the cell membrane, and it is going to stimulate metabolism, which ultimately leads to ATP. Well, what happens is that it's going to attach through a process to receptors in a beta cell. And basically what that means is when there's a lot of glucose, ultimately that is a very complex process to discuss the fact that insulin is going to be released. And the reason why insulin is released, just an FYI, because you're thinking high blood glucose levels, why would they take in more cells? Keep in mind, there's a lot of glucose in the blood. So the body cells other than blood are going to take it in, so it lowers that blood glucose level. Glucagon is antagonistic with insulin. Usually this happens when there's low blood sugar, and generally this is going to be released into the liver. And what it's going to do is it's going through go through a process called glycolysis, which is going to convert glycogen into glucose and pass it into your blood vessels so that it can go to the different parts of your body. Another gland that we talk about is something known as pineal gland. You'll notice that pineal gland is a very, very, very small amount, very, very small gland right here in your brain. What it's going to do is it's going to secrete melatonin. And what happens is melatonin is going to basically dictate our circadian rhythm, which is our night and day cycles. Now, with that being said, it is going to secrete higher levels at night. And the reason why is because melatonin, some of you might take this for sleep deprivation because they do sell this over the counter, but it helps make us drowsy and helps make us sleep. Then we have the thymus gland. It's actually going to be located right behind the sternum, which is your breastbone. Usually the thymus gland is only active during puberty, or only active until puberty. Very, very rarely will it be active after that. And what it's going to do is going to produce a hormone known as thymosin. What thymosin is going to do is it's going to help start the process of developing these killer T cells, which are the disease-fighting agents of our immune system. And then we have our gonads. Some of you might think that you're very, very familiar with gonads, and we'll see about that when we get to reproduction. But our gonads are basically organs that are going to produce gametes, and gametes are just a fancy term for sex cells. And so in the females, we have what are called ovaries, right here and here, and then your males, you have your testes. And so what's going to happen is you're going to have what are called steroid hormones in the ovaries. So two of them that we're going to talk about are estrogens and progesterone. So when starting with estrogens, estrogens are going to help stimulate those secondary sex characteristics. So the widening of the hips, the increased size of breasts, etc. Usually what happens is when somebody is pregnant, the placenta becomes the primary producer of estrogens. That is a huge one. The reason why is because it's going to help maintain pregnancy, and it's also going to help produce milk and going to help prepare the breast tissue for producing milk. Now, progesterone and estrogen are also going to establish the menstrual cycle, and we're going to talk more about that later. So when we talk about the menstrual cycle, we have 4 different phases. The first of which is your follicle stimulating hormone. Then you have your estrogen. Then you have your luteinizing hormone, and then you have progesterone. And so there is this black gap right here. And this black gap is where ovulation is going to take place. This generally happens around day 14. And what that means, ovulation is just a fancy word for saying that it's releasing an egg. Now, if you look at this, these are going to be the primary 4 hormones that are going to be responsible for the menstrual cycle. And so we are going to talk more about the menstrual cycle in more detail later in the reproductive system. So one of the things also we need to talk about in terms of females and reproduction and hormonal issues is something called menopause. So what happens is menopause is going to be the time where females stop menstruating. So they don't have their period anymore. And so what it means also is that if you can't menstruate, your body is not releasing any more eggs. So you're not able to have any more children after that point. So it's the end of what we call the childbearing years. Usually it's around the age of 51. It could be a little bit higher, a little bit lower, depending upon the person. But what happens is that when your ovaries age, they're not going to be able to release as many hormones. So they're not going to be able to keep the menstrual cycle going. So what happens is that you are going to see a variety of different symptoms of menopause. And you can see some of them here. One of the main ones that people talk about is something called hot flashes. Painful breasts is another one that I hear pretty frequently. Incontinence, shorter and longer cycles, bleeding between periods, painful intercourse, dryness in the vaginal canal. But there's a variety of different ones. Mood swings, depressed mood, etc. Usually this is when females go through their quote midlife crisis. That's what generally is the onset of this. Testes are going to produce testosterone. And what it does is it's going to allow for the development of secondary sex characteristics. So that would be like muscles, that would be deeper voice, that would be body hair in the pubic region and in the axillary or armpit region. And also what it's going to do is it's going to help produce sperm. And you can see some sperm cells here. What you'll see is you'll see a head, and then you'll see a little tail, the flagella. And we'll talk more about those more later. And then we have some other hormone producing tissues. So the 4 that we specifically refer to, and they're scattered throughout the different body systems. You have your placenta, which we talked about a little bit. Your heart does produce some of the hormones, but we're not going to talk about those specifically. Kidneys, which works with the adrenal medulla and the adrenal cortex. And then you have your stomach and the duodenum of your small intestine, which remember the duodenum is the first part of your small intestine. So your placenta, what is your placenta? I've said this word a couple times, but some of you probably still do not know what a placenta is. Well, what the placenta is it's an organ that's only temporary. And what it does is it builds around a fetus, and it helps nourish and it helps remove waste from the fetus. What it ultimately does as well is it helps prepare the woman for pregnancy. So it helps prepare the body for delivering the baby out of the vaginal canal. And it does this through producing hormones. And so a couple other things that we talk about are going to be those that some other hormones that are not exactly as important as the ones that we've specifically addressed. The first of which is called leptin. So leptin is a hormone that is secreted specifically by lipid or fat cells. And what it's going to do is it's going to suppress the appetite. If we talk about ghrelin, on the other hand, ghrelin, if you hear your stomach growling, ghrelin, they sound very, very familiar. This is going to be a hormone that's secreted by the stomach to help increase the appetite so that you know that it's about time to eat. So if leptin is higher than ghrelin, I'm sorry, if leptin is lower than ghrelin, so you can see right here, this is before eating. Ghrelin is going to be produced by the gastrointestinal tract, and leptin is going to be very low. And this happens when ghrelin is lower and leptin's higher. So yes, that is what I was meaning to say, sorry. So when this happens, you're gonna be hungry. You're gonna be satisfied or satiety when you've already eaten. And so what's going to happen is leptin is going to be made by the hormones in the adipose tissue, and it's going to send a message to your brain saying, I'm full, I'm not hungry anymore, so please stop eating or I'm going to explode. So the last thing we're going to talk about today is something known as hormone imbalances. So some of the most common causes of imbalances, usually it's due to a malfunction of a feedback system. And it can be a variety of different feedback systems. You can also have disease and infection, injury, genetic disorder, and a tumor can also cause this. Now, here's what happens when you have a malfunction in your feedback system, or when you have one of these other 4 characteristics or causes. What's going to end up happening is you're either going to have a hyposecretion, which means a low secretion from a gland, or you're going to have too much. And what this can do is this can cause some serious health problems. And so a few of them we're going to specifically talk about, the first of which, probably the most prominent one in your mind, is diabetes. So we talked about insulin. Insulin is necessary for glucose because the cells need insulin to help use glucose for energy. And so what happens is we have what is called diabetes mellitus, which means that your body is not going to make enough insulin, and so its cells can't use the insulin properly, or that's another byproduct of that process. We also have what is called gestational diabetes. Gestational diabetes is usually triggered in pregnant women, and that's somewhat common for women that are going through pregnancy. Now, a lot of people ask, Mr. Harms, what is the difference between type 1 and type 2? Well, type 1 diabetes is when your pancreas does not produce insulin at all. And so you're going to require insulin injections. Okay, that's common. Type 2, your pancreas is not going to produce enough insulin, or your body cells are resistant to it. You can actually have to take insulin as a type 2. That is a fun misconception, so just to be aware of that. But what happens is generally this one can often be managed through nutrition and lifestyle choices. Usually if you're type 1, you're born with it. So both types can actually cause a variety of different damages to nerves, to kidneys, to the blood vessels in your eyes. They can increase, the top 2 things they can increase are heart disease and stroke. You also have what is called adrenal insufficiency, which is also referred to as Addison's disease. Basically what happens is that the adrenal cortex glands are not going to produce enough cortisol. Usually this causes fatigue, muscle weakness, loss of appetite. Dark tanning of the skin is another one. So here is a before and after picture of somebody who went through treatment for adrenal insufficiency. And how do you think that happened? Well, they pumped more cortisol into the blood for it to do its job. We also have Cushing's disease. So this is the opposite. So this is hypersecretion, or an increased secretion of cortisol. Usually there's a tumor that is responsible for this. Usually it's on the pituitary or the adrenal gland. And generally, in order to get rid of Cushing's disease, or to curb the side effects and the symptoms of Cushing's disease, they remove the tumor. What you're going to see with this is you're going to see a variety of different things. So you're going to see some memory loss, hyperglycemia, release of adrenaline, thin skin, weight gain, etc. We also have growth hormone imbalances. We've talked about these a little bit. We've talked about gigantism. That's going to be hypersecretion of the growth hormone. Your height is going to be you're going to be much taller, but at the same time, and I'm not talking 5 feet versus 6 feet. I'm talking like gigantism's like 7 feet or above, when the majority of the population is like 5'11" or lower. So what's going to happen is that you are going to see excessive growth, but your body proportions are going to be pretty much the same as any other individual. Then you have your acromegaly. This is going to be a hypersecretion of the growth hormone in adults. So gigantism happens in children, whereas acromegaly is going to happen in adults. So these pictures were actually taken. This is the same individual, 17 years apart. What happens is that certain features become enlarged. So for instance, you'll notice that the forehead, the nose, the mouth, You'll also notice sometimes the jaw, which you can kind of see right through there, feet, hands, legs, etc. You also have pituitary dwarfism. This is going to be a hyposecretion of the growth hormone in children. Usually this is delayed growth, and this is where you get the term dwarf from. So this is going to lead to an individual that's going to be below average, and this is generally caused by some sort of dysfunction in your hypothalamus. Usually they have normal body proportions similar to gigantism. The type of dwarfism that produces short stature, short limbs, a large head is a genetic disorder by the name of achondroplasia. But hyposecretion is going to, in adults, is going to lead to loss of muscle mass, loss of bone density, depressed moods, and also low energy. Then we have some thyroid imbalance, hormone imbalances, and we've talked about these a little bit. So what's going to happen is that I believe I talked about hypothyroidism a little bit. One of my friends from one of my previous positions had what we call hypothyroidism. So that's the one I'm going to talk about. Basically what happens is that T3 and T4 are going to be underproduced, which is going to lead to a variety of different things, fatigue, depression. The biggest one is going to be weight gain. So with this particular individual, she was a very, very, very large lady, and no matter what she did, she could not lose the weight. She eventually did, but they found that she had a thyroid hormone imbalance, the T3 and the T4. The most common cause is going to be Hashimoto's thyroiditis. We're not going to get into the specifics of it, but if you're interested, please don't hesitate to Google it. In terms of hyperthyroidism, this is going to be specifically caused by the overproduction of T3. So what this is going to cause is it's going to cause a rapid heartbeat, weight loss, and some numbness. Now, a lot of times it's caused by something known as Graves' disease, which is an autoimmune disorder that's going to attack the thyroid gland. Now, both of these can be often treated with medications, but in terms of specific names and such, it's beyond the scope of this class. And then we have the polycystic ovarian syndrome. So what this is going to do is, if you look at this picture, you'll notice that there's healthy ovaries on this side, and then you'll have polycystic ovaries. PCOS, or polycystic ovarian syndrome, is the most common cause of infertility. Basically what happens is you have these pus-filled cyst fluid pockets on the ovaries. And then what this can be caused by is either an excess amount of insulin or an excess amount of androgen. What these are going to do is this is going to cause for a lot of issues. It's going to cause pain. It's going to cause abnormal menstruation. It could cause depression. It could cause high blood pressure, etc. So that is the end of notes for today. What we are going to do next, and what I'm asking you to do next, is you are going to finish, if I can pull this up, you are going to finish your hormone endocrine system summary chart, your hormone chart. I will post that on Google Classroom. The other thing that I would like for you to do is I am going to give you this activity. This is hormonal control of blood calcium levels. So I ask that you please do that as well. I believe that that is all that I have for you, but I want to double check. This is another thing that's on the back of that. I'm going to post it on Classroom. Feel free to do it if you need it. If you don't need it, that's fine. But that is the other thing that's on the back of that sheet. I knew there was something else. And these sheets are going to be in the study hall room. So you're going to need to pick them up, and I'll have them labeled as anatomy and physiology, etc. So please don't hesitate to ask any questions. I'll be available via email, and just let me know. Thanks for watching.